Hi, and welcome to another exciting interview with FITsOnTheGo. My name is Norma Gamarra, and I'm currently serve as the co-chair of the medical student member community. Today, we have the honor to have Dr. Katia Bravo, who is a board-certified cardiologist with an expertise in adult congenital heart disease, and who also serves as an assistant professor at Mayo Clinic School of Medicine. Dr. Bravo, thank you so much for your time.
Thank you, Nicole. Happy to be here.
So today we're going to talk about ACHD residency and how fellows can improve their training on this. So Dr. Bravo, from your perspective, how do you think that ACHD training evolved during the past few years, and what do you think are the adjustments that need to be continued integrated in the training programs?
So adults with congenital heart disease, or ACHD, are an increasing population. In 2010, it was calculated that there were over 1.4 million adults with congenital heart disease in the U.S. And by 2025, we expect that number is a lot higher. So FITs will encounter, inevitably, adults with congenital heart disease in their practice. We have learned that this number is as important as the number of patients with atrial fibrillation. So let's just let that sink in and realize that this population is really out there and we need to learn how to care for them. The training has evolved significantly over the past decade. Before, there weren't even programs that were dedicated to train cardiology fellows in ACHD, and less so specialized programs dedicated to ACHD were really few. Nowadays, we have over 24 accredited programs that train ACHD fellows and future cardiologists, and they are located throughout the United States. Globally, there's a significant mismatch in terms of ACHD fellowships, and we have recently finished a manuscript that depicts all these panorama across the globe. So there's significant areas where we have a lot of shortage in this cardiology training pathway, but we also recognize that despite we are having really good efforts at trying to recruit, still we have empty slots. So we gotta start from the significant facilitators and barriers that are helping us recruit cardiology fellows who are interested in ACHD and help them make the right decision, realizing that this is an increasing population with huge complex needs, but that it's also a very rewarding field where they will encounter patients who are loyal, patients who have a resilient story, and they are also paying back to all the teams that were able to help these patients survive to adulthood.
And in that sense, talking about ACHD patients, what do you think are the greatest challenges that fellows affront when they are taking care of these patients?
I think the main thing is that ACHD sometimes is taken like an allergy. I have an ACHD patient. Oh, what is the anatomy? Or I have an ACHD patient. Oh, I'm worried about, mental health issues. But in reality, once we realize that these patients are just like any other patient who has been in the medical system for decades and has had significant experiences, good and bad, we try to humanize what their experience has been, and we try to empathize and try to break down the complex concepts into simple ones, starting with the anatomy, then the physiology, then the repairs, and trying to really make sense of what has happened to that person with congenital heart disease throughout this several decades of their lives and their medical complications. It's also good to reconnect with who that patient is and the family dynamics, because that will help us get really, all the trust from the patient and the family, who many times have been around healthcare much more than many vets.
And in the force to continue improving this patient care, what advice would you give to the fellows who wants to be more involved in research, for example, for this?
I think the first thing is to do an internal soul search and see if you're passionate about something or if something really makes you angry. What is that thing that you internally realize you need to fix? Maybe there is a problem that you have identified in your day-to-day practice that you are really deeply concerned about. And that's going to be an internal fire. It's going to be an internal motivator. And you may want to start asking yourself, who are the best mentors in that specific field that you can work with, not only by the publications, right, but also by the word of mouth. Maybe you have friends or other FITs or other colleagues who have worked with a specific mentor, and you kind of, predict how this can be. Once you've done a lot of basics research on who this mentor might be, you have to reach out. Nobody is gonna, come to you directly. You have to reach out, but you have to reach out in a way that is well prepared, where you have a goal and you also set up expectations. We have to go with a clear mind to the mentor and really establish a plan of how you want to conduct your project or the mentorship activity that you're interested on specifically. And after that, when things are very clear and you have a plan, then you just got to run away with it.
And just to finish with the interview, something that is important with ACHD patient is to take in account about their backgrounds, their geographical and disparities different background. So in that sense, how do you think given your own research, for example, the Andes HDAI study, can help fellows to get more involved with their patient in this sense?
So going back to what I said, right? Finding that little spark of fire that lit up the forest. When I was in Peru training as a medical student, I had the opportunity to come to the States to do an exchange program. And the following year, I was able to rotate at the Children's Hospital in Wisconsin, Milwaukee. And there I met Dr. James Tweddle, who showed me how the stages of the Fontaine repair were. He was a significantly important person in showing me how congenital heart disease could be palliated in a very, very significant manner in the U.S. Following the years, I had my pediatric cardiology rotation in Peru, and I was seeing 5-year-olds coming with tricuspid atresia completely cyanotic and really without access to care. So that really sparked the fire, and that made me realize that we need to do much more for early detection of congenital heart disease in underserved areas such as the Andes. So that led the subsequent steps to reach to different tools that we could use for early detection, including oximetry. And unfortunately, at high altitude, we have up to 27% of false positives, which is a big limitation to really detect these babies in an efficient manner. So we started asking if AI, ECG, could help us in this setting, and that's the basis of the Andes CHD AI study. I think that having some sort of sense of what your true passion is number one. Surrounding yourself with the great mentors and the tools is number two. And the third thing is to really round that up with the other steps that you need to not only create the tool and the research, but also disseminate it and implement it in your area. So we have worked with the Patient Association in Peru, with many colleagues, cardiologists, pediatric cardiologists, surgeons, and we were able to pass a law for early congenital heart disease screening in Peru last year. And then this year we have the rules and regulations published. So we got to go all the way from basics to the end and keep at this mission. So I hope this story could inspire other FITs to continue pursuing their dreams and identify that fire that could spark and then lit up the forest.
Thank you so much, Dr. Bravo, for your time and for this inspiring and informative talk. And please, for more videos like this, check out our YouTube channel at youtube.com/FITsOnTheGo. Thank you.
Thank you so much.